Education for a high-risk camera client. Client is 20 years old, presented with a full band brackets, tight contact, gingivitis, and high camera. We came up with this diagnosis after we did the first assessment and we went through the camera form and the office form that you filled. We will be doing our best to try to resolve this problem and improve your oral health. In order to do that, me and you will be working as a team. We will do some adjustments and I will be giving you few recommendations to be done at home and in office. The first thing that you need to focus in doing at home is mainly your lifestyle, mainly your diet. As a client who have full orthodontic brackets, there is some limitation and restriction with what you're eating. You need to avoid few foods such as the hard nuts, the meat and bone, the sticky chewy food, which is what you like to snack on. I understand that most people would love to snack on these sticky, sugary, yummy food, but we need to stay away from those type of food, especially that they have a really high ability in changing the pH of the saliva, which is mean that we may provide a really good environment for the bacteria to grow and multiply and causing more damage. The second option that I would like to talk about here is the fluoridated toothpaste. Fluoridated toothpaste, mainly the one that contain 1.1 sodium fluoride. I have two different options here. We can go with Colgate Privy Dent, and you can get it from Amazon, from any pharmacy. And the other one is Climbro 5000. This one need a prescription. They both work great. They are very strong toothpaste. They help preserving the white spot lesion, preventing any remineralization of the tooth enamel. They also aid in the caries prevention. The prices range from $13 to $15. The second thing that I would like to recommend is using a mouthwash containing 0.12 chlorhexidine. We have two options here, the Peridax and the Listerine Advanced Defense Gum Treatment. Both of these containing the chlorhexidine, which we need to be careful when using. So the main dose is using it for 1 minute daily, at night, 30 minutes after brushing your teeth for 1 week a month. These mouthwashes have an ability to treat symptoms of gingivitis and reducing inflammation. Prices are ranging from $15 to $20. Third option here, we have the xylitol tablets. Xylitol tablets is mainly a naturally sugar alcohol. It controls the bacteria and reducing the quantity of the plaque. It also helps in stimulating the saliva. The dose for these tablets is 6 to 10 grams daily, divided 3 to 4 doses, 5 to 10 minutes per exposure. We have two different brands here. We have the X Pure and the Therament. The main difference is just the flavors, and price different that goes from starting from $22 to $45. You can get these from any drugstores or even Amazon. As I said before, this is going to be a teamwork, so it's you and me together. Before starting this care at home, we first need to do a few things in office. The first thing and the most important thing is doing scaling, removing this plaque, removing this biofilm, removing this calculus in order for us to help you maintaining your oral health and resolving your inflammation that's happening in your gum. The second thing is we need to start booking you few appointments called a restorative appointment, which is mainly fixing these decayed teeth, try to remove these caries and fill it with a new filling and restore it. The third thing we will be recommend is having a recur exam every 3 to 4 months and taking extra radiograph. I know today we did the assessment exam for you, and this assessment and the x-rays that we took today is going to be our baseline. This is going to be the exam that I will be coming back every time you come for a recare in order for me to start comparing the results and see if what we're doing is working or if we need to do any improvement or change anything with the care and the treatment plan that we have. The fourth thing that I would like to recommend and prefer to do it today is having a saliva and a pH testing. It's mainly just to check the pH level and balance in your saliva. The balance that we are looking for is from 6.2 to 7.6. This is a perfect balance in order not to allow this cariogenic, the bad bacteria, to live and destroying your teeth. And for the last thing that I would like to recommend to do is fluoride varnish and fluoride sealant in order to help with remineralization of your teeth. As you can see in the picture, the difference mainly is when doing a fluoride varnish, it's just painting a very thin liquidy material on the tooth, and that's on the front, the back, the top, the bottom of the teeth. It's very thin, but it really can help in remineralization of the tooth, and we prefer to do it 1 to 3 applications in every recur exam. The second picture over here is a fluoride sealant, and some people think it's a composite, it's like the white filling, but no, it's more liquidy. So we do the same thing. We're using a very tiny brush to brush it in the groove of the big teeth, and that will maintain those grooves and keep them clean and have no bacteria inside, so eventually having no cavities in these teeth.
In this short video, I want to show you how to prevent gum disease and keep it healthy, and how to prevent cavities on your tooth surfaces during orthodontic treatment, and how to prevent bad breath by cleaning your tongue surface. There are several oral hygiene tools. Interdental brush, the price is there, and you can order to Amazon or buy from Shoppers Drug Mart, and also Trader floss or floss trader along with dental floss. The prices are there. I can give you all these information. And this is tongue cleaner from Shoppers Drug Mart. It's almost $7. And these are 2 different brands, Life and Colgate, and the prices are there. Special pattern of the bristles help to clean your teeth with the correct method I will show you. And this is gum stimulator, and also water flosser is very useful to clean your teeth in between the teeth interdental spaces. This is interdental brush for cleaning the spaces between the teeth and also under the wire besides the bracket. It will enter the tooth surfaces under the wire besides the brackets. This is the Trader floss for cleaning the interdental spaces. This Trader floss has one side with a little bit rigidity. It can goes under the wire. And then with the tight contact, a little bit sliding, contact one of the tooth surfaces all the way down from your gum until the tooth biting surfaces, and also to the other tooth the same. Assume this is the tongue and you want to clean the tongue. This is the tongue cleaner. You will start from back and touch on the tongue surfaces and go to the front of your teeth, and start from back to the side, from back to the other side. You can do this several times. This is water flosser. It has a tank for filling the water and also different modes. It's for child, pulse, soft, strong, and the pulse one makes the stream from the head. This is the head for orthodontic purposes. Some bristles on it. This water flosser has a tongue cleaner also. You can use this one and no need to buy an extra one. Water flosser is a good option for cleaning the interdental spaces. You can put the tip of the water flosser between the two teeth at 90-degree angle. Turn on the device and the water will push with a pulse motion, and you can go under the gum area between the teeth and on the tooth surface. For brushing your teeth, you can start from the upper right side, go all the way to the left, and then trim surfaces. And after finishing that, go to the lower, brushing your lower teeth. All these brushing takes 2 minutes, should be 2 minutes, and twice a day, once in the morning and once before going to the bed. For brushing your teeth while you have a bracket and wire, orthodontic wire, the hand brush bristles should be placed on the gum area at 45-degree angle, small vibration, back and forth motion, and then go through the other part all the way down. Also for lower teeth, 45-degree angle, small back and forth vibration motion, and the bristle goes under the wire and around the bracket to cleaning your teeth surfaces, along with the trader floss and interdental proximal brush or interdental brush. It's also very important to brush the other surfaces of the tooth under the bracket for cleaning the tooth surfaces around the bracket. And I like to inform you the most effective brushing technique is electronic toothbrushing.
Let's talk about brushing. Brushing is really important. Finding the right technique is really important too. But what is the most important is to find the proper tool to do that. We recommend brushing your braces with an electric toothbrush. I really like Oral-B brushes because it has a special tip that you can use. Like you can just insert, take this off, and you can just insert the other tip that is mainly designed to clean in between your brackets. First, you need to start from the back molar on one side, and then you will be working your way tooth by tooth to each side. Let me demonstrate the right way for brushing using this Oral-B electric toothbrush. We'll be turning this on. The first thing we will be doing is angling these bristles to clean anything in between your braces and your gum line. And as you are seeing, I am angling and I'm tilting my brush downward. I will be walking slowly and gently, guiding my toothbrush in this way. After that, we will be flipping our toothbrush to go upward and towards the tooth surface to remove any bacteria under the brackets. The last thing, we will be going directly over your brackets. And that just with using the regular head. To go in between your brackets, you will be needing to use the specific head that Oral-B created to use with patients who have brackets. From the inside or from the inner surfaces of your teeth, you will be just going tooth by tooth in the same regular way that you used to brush your teeth before, because there is no brackets and nothing is attached over here. That is the main way and the main technique to have the best results with cleaning your teeth.
The last one is gum stimulator or rubber tip stimulator. It's very useful for massaging your gums and become healthier. Put the tip between the teeth at 45-degree angle, in and out motion, and massage your teeth. And also you can put the tip at gum level and massage whole the gum surfaces.